Good evening, doctors. Today we are going to study about the multiple choice questions of anatomy, which is a typical intercostal nerve. A. First intercostal nerve. B. Second. C. Third. D. Seventh. First, second, third, seventh, which is a typical intercostal nerve. Typical intercostal nerve are the ones that are confined to their own intercostal spaces and in the thoracic wall. The third, fourth, fifth, and sixth intercostal nerves. Third, fourth, fifth, and sixth intercostal nerves are typical nerves. So the correct answer here is C. Third. Third, fourth, sixth intercostal nerves are typical intercostal nerves. Third, fourth, and sixth are the typical intercostal nerves. So the correct option here is C. Third. Trendelenburg test is positive due to injury to which of the following nerves? A. Obturator. B. Sciatic. C. Superior gluteal. D. Inferior gluteal. A. Obturator. The correct option here is C. Superior gluteal. Positive Trendelenburg is relatively non-specific and may indicate pain. Pain due to osteoarthritis of hip joint. Weak hip abductors. Gluteus medius minimus. Short femoral neck fracture of neck. Dislocation, dislocation or subluxation of hip. Neuropathy. Gluteus medius and minimus are supplied by superior gluteal nerve. Trendelenburg test. Normally, when a person is made to stand on one leg, the hip abductors of ipsilateral side raise the opposite, and the unsupported side of pelvis. If the abductor mechanism is defective, the unsupported side of pelvis, if the abductor mechanism is defective, the unsupported side of pelvis drops and is known as positive Trendelenburg test. Which among the following is not a branch of arch of aorta? Arch of aorta. Which is not a branch of arch of aorta? Correct option is right common carotid artery. The arch of aorta begins at the level of upper border of second sternocostal articulation of the right side. The branches given off from the arch of aorta are three in number. The brachiocephalic, that is innominate artery, the left common carotid, and the left subclavian artery. So the branches of the arch of aorta are the brachiocephalic artery, that is innominate artery, the left common carotid artery, and the left subclavian artery. Brachiocephalic artery is the largest branch of arch of aorta. It divides into right common carotid artery and right subclavian artery. So the correct option here is right common carotid artery. Boundary of Koch triangle is not formed by boundary of Koch triangle is not formed by limbus fossa ovalis. Sympathetic supply to heart arises from which of the following spinal segments? T1 to T5. Sympathetic nerve cells supply the heart are located in the intermediolateral horn of spinal segment T1 to T5. Sympathetic supply is cardioaccelerative, and on stimulation they increase the heart rate and also dilate coronary artery. Both parasympathetic and sympathetic nerves form the superficial and deep cardiac plexus, the branch of which run along the coronary artery to reach the myocardium. So T1 to T5. Inferior pancreaticoduodenal artery is a branch of which of the following arteries? Superior mesenteric artery. Inferior pancreaticoduodenal artery is a branch of which artery? Superior mesenteric artery. Superior mesenteric artery. Inferior pancreaticoduodenal artery is a branch of which of the following arteries? It is superior mesenteric artery. Facial nerve is a derivative of which branch? It is second arch. Facial nerve is a derivative of second branchial arch. Muscles of facial expression are derived from it. It are buccinator, auricularis, frontalis, platysma, orbicularis oris, and orbicularis oculi. Buccinator, auricularis, frontalis, platysma, orbicularis oris, and orbicularis oculi. Additional muscles supplied by it are stapedius, stylohyoid, and posterior belly of digastric. Which of the following nuclei belong to general visceral efferent column? General visceral efferent column. A. Facial nerve nucleus. B. Trigeminal nucleus. C. Dorsal nucleus of vagus. D. Nucleus ambiguous. Visceral afferent fibers are also called general visceral afferent fibers. Convey sensation from alimentary tract, heart, vessels, and lungs by way of nerves 9 and 10. A specialized visceral afferent component is involved with the sense of taste. Fibers carrying gustatory impulses are present in cranial nerves 7th, 9th, and 10th. The general visceral afferent column is represented by part of dorsal nucleus of vagus. Internal anal sphincter is a part of Internal anal sphincter is a part of D. Internal circular fibers. Internal circular fibers. Involuntary internal anal sphincter is located by found by thickening of circular muscle layer. Circular muscle layer. Which structure passes behind the inguinal ligament? 10. Femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. That is femoral vein and psoas major. So correct answer is femoral branch of genitofemoral nerve, femoral vein, and psoas major. D all. Posterior communicating artery is a branch of posterior communicating artery is a branch of internal carotid artery. Posterior communicating artery is a branch of internal carotid artery. Internal carotid artery. Correct answer is A. Primary and secondary palates are divided by primary and secondary palates are divided by incisive foramen. Incisive foramen. The right suprarenal vein drains into the right suprarenal vein drains into inferior vena cava. Correct option here is A. Inferior vena cava. Oribas plexus is present in Oribas plexus is present in colon, esophagus, and stomach. All of the above. Oribas plexus is present in colon, esophagus, stomach. All of the above. Intercalated disc is present in Intercalated disc is present in A. Cardiac muscle. Cardiac muscle. Which is true about synovial joint? Which is true about synovial joint? Stability is inversely proportional to mobility. Nerve supply of stapedius is Nerve supply of stapedius is seventh cranial nerve. Small muscles of hand are supplied by Small muscles of hand are supplied by C5 to C7, C8 to T1. Structure passing deep root flexor retinaculum at wrist is the median nerve. Azygos vein drains into superior vena cava. Superficial inguinal ring is a defect in external oblique aponeurosis. Ovarian artery is a branch of abdominal part of artery. Meckel's cave is related to trigeminal ganglion. Medulla oblongata is derived from Medulla oblongata is derived from Medulla oblongata is derived from correct option here is myelin capillon. Longest spinous process C7. So once again, we will revise the MCQs one by one. Which is typical intercostal nerve? It is third nerve. Tendular bucket is positive due to injury which are nerve superior gluteal. Which among the following is not a branch of arch of aorta? It is right common carotid. Boundary of Koch triangle is formed by all except limbus fossa ovalis. Boundary of Koch triangle is not formed by limbus fossa ovalis. Sympathetic supply of heart arises from T1 to T4. Inferior pancreaticoduodenal artery is branch of which of the following? Superior mesenteric artery. Facial nerve is a derivative of second arch. Which of the following nuclei belong to general visceral afferent nuclei? Dorsal nucleus. Internal alar sphincter is a part of internal circular fibers. Which structure passes behind the inguinal ligament? Femoral branch of genitofemoral nerve, femoral veins, vas major horn. Posterior communicating artery is a branch of internal carotid. Primary secondary palates are subdivided by incisive foramen. The right suprarenal vein drains into right inferior vena cava. Aurobach plexus is present in colon, stomach, esophagus, all of them. Intercalated disc is present in cardiac muscle, which is true about synovial joint. Stability is inversely proportional to mobility. Nerve supply of stability is seventh cranial nerve. Small muscles of hand are supplied by C47, C851. Structure passing deep to flexor retinaculum, median nerve. Hygiogous vein drains into superior vena cava. Superficial inguinal ring is a defect in external oblique appendicitis. Ovarian artery is a branch of abdominal part of the earth. Necas cave is present. Trigeminal vein. Medulla oblongata myelin capillary. Longest spine is process C7. So with this we conclude with the anatomy. I will come with deep explanations tomorrow morning. Till then, take care. Prepare well. You all will succeed. I believe in you.